I want to talk about how to advocate for yourself in the medical setting, especially as a female or femme-appearing person, especially as someone who is neurodivergent, and especially if you have like a lot going on, like a lot of health issues. For brief backstory, when I was 13, almost 14 years old, I almost died from a rare bone infection called osteomyelitis in my left hip, and I almost died because of a lack of advocation. A lot of neurodivergent people, particularly people assigned female at birth, tend to have a higher pain tolerance a lot of the time, not all of the time, sometimes it's lower. And I feel like a lot of the time we see this because so many of us have had to mask in so many other ways in so many other parts of our lives. We're just constantly having to conceal parts of ourselves and the way that we feel and want to react to things in order to appease other people and to be considered like normal members of society. And this will directly affect the way that we get treatment and seek treatment and the standard of, the quality of that treatment that we receive. Because when you have such a high threshold for pain, because you have to have a high threshold for negative stimuli, because when you're a neurodivergent person, you're constantly being attacked with negative stimuli, and you tend to be a pretty overstimulated person, so you've developed ways to cope. And unfortunately, we tend to use those ways to cope with things that could be life-threatening or that are actually harming us. I coped with the osteomyelitis until I was basically on my deathbed. Again, when I was 20 years old, I had kidney stones, and I had a completely obstructed left ureter, and I was in kidney failure and had acute kidney injury. And I was 2 days into a music festival, and I was just toughing it out. There are jokes in the medical field where if a farmer comes to you and tells you that, like, he's got chest pain, then you need to, like, start resuscitating him immediately, basically, because once a farmer comes in and actually complains, it's serious, because farmers aren't gonna come off their land and away from the farm to come complain. Same thing with neurodivergent people, okay? When we're finally complaining and we're seeking help, give it to us. It took a lot to get to that point. So now that we know why it can oftentimes be hard to advocate for ourselves and to seek treatment, let's get into how we can actually do that. Almost every specialist in the book, I have many chronic health conditions, unfortunately. Up here it says urology concerns, you can't see, but I have each of my memos for each specialty. This one. So here I have my chief symptoms of complaint. I have some testing that I was curious about, obviously not telling my doctor to run these tests. And then I have a medication I was curious about trying. And then I have some things that I want to just rule out because they're in my family. I have a family history of them. And as well as the labs of concern that are directly related to everything else. So, medication I was thinking about, and more importantly, your chief symptoms of complaint. Not all of the symptoms, there are plenty more than this. My chief ones, my most important pressing issues that I need addressed for my quality of life. And then if you're a real nerd, any testing that you may have, they tend to not be as happy about that one, but that's just me. Main thing, come with your chief symptoms of complaint. Make sure you can make a separate list with all your symptoms so that they know, like, this is something that is really bothering you. But also make sure you have a separate area with your symptoms that have your chief symptoms. Like, if I'm having, like, for my urology, like, say I have, like, I'm burning, like, I have burning pee, and I like, have, like, pelvic pain, too, like, cramping, and I'm, like, feeling like I'm peeing, but not so much is coming out. Like, I'm gonna list those symptoms, and I'm gonna list, maybe that comes with nausea, and it's been giving me a headache, and I've been feeling kind of dizzy, but if most of the symptoms, or the most pressing one, is that, obviously, that burning while peeing is probably gonna be the most pressing in that situation, that's gonna be at the top, and I'm gonna have that as chief. Because if you come into the medical setting, and you have all this stuff going on, which you do, and you just throw it all at them, they get very overwhelmed, and, like, they start to look at you like, do you have anxiety on the chart? Unfortunately, that's how that tends to go. It shouldn't, but that's unfortunately how it goes. I understand that you have, like, so much going wrong, but we have to just attack things bit by bit. I see urology, rheumatology, cardiology, I see all the ologies, and this is what I do with each and every one of them. For instance, the way I got diagnosed with POTS, postural orthostatic tachycardia syndrome, was I did this. I made a list similar to this. I had my chief symptoms of complaint, which for me was heart palpitations, my heart rate constantly, like, tachycardic. I was deferred from donating plasma because I was constantly tachycardic. I had, like, my vision would go black. Every time it would happen, I would be like, oh, there's a symptom that I should probably, make note of. So I'd quickly whip out my phone, go to my memos, and I would jot it down. And then later on, I'd go through the symptoms and be like, okay, well, these are the most problematic and concerning for me. I'm gonna move these to the top. So I would address the doctor. And if certain symptoms, like these seem to be like GI symptoms, and then these seem to all be like unrelated head issue like symptoms, separate them all like that. So again, you're not going to the doctor saying, oh, I've got this, 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 and this, and they're looking at you like you got 3 heads. In order to advocate for yourself, you have to be able to, like, unfortunately not sound crazy to them. I hate to say that, but that's how they treat you. Now, the next thing besides list is definitely bring an advocate, a patient advocate of your own. Bring, better yet, someone who sees you like the most. They see your day-to-day life and how your quality of life is. So if you have a roommate that you're cool with, if you have like a best friend that you see all the time, you have a coworker's a good one because they work with you a lot. If they're able to work with your schedule and go to your appointment with you, your parent, your best friend, your significant other, anyone who can vouch for you and say, yeah, I have seen this person and how they struggle in doing this day-to-day activity. Like, have them come to your doctor appointment with you. Both of you mutually request off the same time or whatever for this block for y'all to go to your appointment together. And have someone there who can vouch for you and say, yeah, look, this person is not good at advocating for themselves, so I'm here to help them do that. They are very polite, and they cannot articulate just how much they are suffering. I watch them, struggle to get up and go make themselves a meal. I watch them sit in the bathroom for hours on end, struggling on the toilet. Whatever your problem is, make sure you have someone if you can. I know it's not everyone has this, but hopefully you can have somebody, a coworker, anybody who can just request off a little block of time to come do a 30-minute, hour-long appointment with you to advocate for you. Have your list to be your self-advocate, but make sure you have a person who can come with you and tell you, like, look, firsthand, I have seen this person's struggles, and I need you as a doctor to take them seriously and help them, because they're not very good at articulating just how severe things are. I hope this helps.